Okay, thank you everyone for joining our virtual innovation seminar tonight. We have with us a special guest, Kelly Landsman. Kelly is a biomedical engineer with 20 years of industry experience in R&D of patient care related technologies. She's also a registered nurse with experience in adult cardiology and perioperative nursing. Her passion lies in bringing nursing voices to the forefront of healthcare design processes and striving to ensure positive healthcare experiences for both patients and clinicians. Kelly is a passionate advocate for the role of the nurse engineer, hosting the website nurseengineer.com. She founded and is the principal nurse engineer of Landsman Engineering LLC. She has been directly involved in the design, development, and launch of at least 7 medical devices and is an inventor on 6 issued patents. Recently, Kelly has been partnering to focus the lens of the nurse engineer on the next generation healthcare workforce and nurse innovators. Thank you so much for joining us, Kelly. What a background that you have. That's incredible.
Oh, thank
Um,
you.
yes. So, um, for those that don't know, my name is Tiffany Kelley, and I was just going to ask Kelly some questions tonight and have a conversation. If you've got questions as they come up, please put them in the chat, raise your hand, and we'll have a nice dialogue. But the first question is really just so I just read your bio, but tell us a little bit about yourself that maybe your bio doesn't reveal and how you came to be a nurse engineer.
Absolutely, I would love to share. And thank you so much for having me. I'm very excited about the work that you're doing in your center. And got to hear a little bit about the pitch competition, which is very cool. I'm glad that that went well. It's hard when someone reads your bio, you're like, really? Did I do all that stuff? But it's true. I have been in biomedical engineering for almost 20 years. Um, but I should give full disclosure, and I usually try to, that I was raised by both a nurse and an engineer. I can remember back to high school, even then struggling to kind of figure out where I wanted to go with my professional interests and etc. Um, and I reflect back on when I was a kid, I'm just a passionately curious person. Loved the human body, always marveled at the complexity of systems within the body. I mean, nothing else that we know of as a machine can function anywhere close to um, what living creatures can. And my family that was physicians resoundingly told me like, no, you don't want to be a physician, even though that's the route that I was like, no, that's what I want to do. And they said, no, Kelly, it is not what you want to do. I didn't understand at the time why they had put that out there, what it was, but you don't know yourself very well at that age. And so I just kind of followed along. I ended up kind of going through a different pathway. I explored chemistry, biochemistry, and then I decided to go into chemical engineering, which was very cool, a set for the fact that we talked a lot about oil.
Okay.
I do not want to refine oil. So luckily, in my 4th year of school, they had just accredited the biomedical engineering program, and I was able to specialize in biomedical engineering with an emphasis in materials. So my chemistry, biochemistry sort of all ended up coming together. But through that, and I say this because I ended up doing an internship between my 4th and 5th years of school with Abbott Labs. And I got into Abbott Labs through their analytical chemistry department. And when I was there, I went around to anyone who would talk to me and ask them, like, will you hire me as a biomedical engineer? And their answer was, what is a biomedical engineer? And I was like, what do you mean, what is a biomedical engineer? So even back then, my experience into that profession was one of newness. So I started the program again the year that it was accredited, and it was sort of a newer area of study. So anyhow, I got into that area doing medical device design and development. I was in a rotational program when I first got out of school, so I ended up going through all these different businesses. And for whatever reason, the products that I was assigned to, or the projects I was assigned to, ended up being much different from my training, which was like biomaterials, so implants, those types of things. They all happen to be what I call patient care devices. And I call them that because they're significantly different than, say, like an implant, or even, a medical device that has a single user, like let's say a surgical instrument or something, because they touch so many people, right? There's patients, there's caregivers, there's nurses, there's physicians, there's supply chains that have to go into the different aspects of it. And so the number of users that we ended up encountering were pretty significant, and the context of use was also highly variable. So anyhow, I did that for a very long time. I moved around to different companies, big, small, startup. I've had my own business for, I don't know, almost 12 years now, doing consulting for various different people. So whether that be new solo inventors or big companies across the board. And I will tell you that my experience had a lot of similarities for all of them. And what that was that we never got it right. When I say that, I don't say it lightly because, I was the engineer that wore the devices. If it was something that was supposed to be worn for 7 to 10 days, I would be wearing it for 7 to 10 days. I would do failure testing on different devices. It was supposed to be used, 100 times. I would use it 100 times. Thought that I knew, watched clinicians in their settings, and asked my family, who were clinicians, give it to me straight. Just tell me what is wrong with this device. You can't hurt my feelings. And they would say to me, well, Kelly, you just don't get it, which was infinitely frustrating, right?
Mm.
And we would do all these risk analyses, and all these mitigations would end up being clinician training, a whole host of issues. And so when I got my chance to go back and expand my education, I really thought long and hard about what I wanted to do. I had applied, multiple PhD programs and whatnot, and it just, none of it quite seemed to be the right fit. And so I set off on this question campaign where I contacted anybody and everybody who was willing to pick up the phone. I contacted couples that were nurses and engineers that had gone into business together. Anyone that had touched any kind of engineering and nursing, anybody that wanted to talk about why we weren't getting med device development to meet the need. And what I came to, the most impactful advice I got was, you can't change the system unless you're in it. So I knew that I knew the med device field from various aspects, but I didn't really know nursing. So in 2019, I went back. I did a 16-month master's. I got my degree in nursing over COVID. And sometimes I wonder exactly why, why that happened. But as part of that, I really got the full experience of what it meant to be in a system that was radically in change, what that onboarding looked like, the gap between the know and do. So anyhow, I ended up getting my nursing degree, graduated in 2020, and then spent 2 years bedside. But again, all with the passion of exploring, how do we bring nursing and engineering into the same place. So that's a little bit of my background and a very long answer about how I came to be a nurse engineer. I've been away from the bedside, unfortunately, because I couldn't find a role that would let me do project work and bedside at the same time, which we can go into later. But
Yeah.
I've been combining the role of the nurse engineer in improvement-based projects, workforce-based projects for, I don't know, almost a year and a half now. And every day I continue to learn more about why nursing and engineering, what they have to add to each other, and how we really collect diverse perspectives to help make better solutions to the things we need.
And you and I spoke just briefly before starting, and what's very intriguing to me about your story is starting as an engineer and then making the decision to go and become a nurse. And one of the things that I had said to you was that I will often hear um, either I'll hear it from other nurses or I can sort of see them sort of wondering, what exactly does it mean to be an engineer? And so you started with that foundation, and then you tackled the I don't get it comments of, what is it about nursing that I'm missing that would put this puzzle together? So I guess that leads me to the next question I had for you, which was, how would you define a nurse engineer? What does that mean to you?
So these are very good questions, and those that I continue to reflect on. So I'll start with some of the things for me that I thought was a nurse engineer. My dream was to get interprofessional people at the bedside, solving problems in real time. There was so much disconnect between what we saw, what we did, how we got it back, um, what you really understood to be true and not true. And that was what I originally had thought. Oh, okay, nurse engineer. But what I've found in the process has been absolutely fascinating. And there's a variety of roles, I believe, for people that are dual trained, but also have been adding, and this information on the website as well, but adding to the concepts of about how we form partnerships, how we utilize each other's work, how we partner to really move things forward. So there's a lot of ways you can define a nurse engineer. The first I would talk about is just a bridge builder. So I would argue to say, more than 50% of the challenge is making sure that when you're talking to someone, you're saying the same thing. So we use different languages. We have different upbringings. We have different experiences. So the products, even used in the lab, are different than when they're used on the floor. And I can give you an example of that. It seems like a really lame example, but I will never forget how I felt the first time that I flushed someone's IV. Just saline, nothing more. So I had worked all the way from the chemistry part of it to the injection molding of the plastics of the syringe. I mean, I knew everything about how they made the saline, how it was sterile, how the whole thing was sterilized, what the prints of the syringe looked like, how much force it would take to push the syringe. I thought I knew a lot about syringes, but the first time I ever flushed someone's syringe with saline, I was shaking. I had a sick feeling in my stomach, and I thought, this is nothing. This is nothing like I had ever imagined a syringe before.
Really?
Um, so reflecting on that, I mean, I could go on for quite a while, but it's just this different aspect of yourself. It's a whole different set of senses. It's a whole different part of your brain. That feeling that you have with a person staring at you, knowing that they are depending upon you, that they are trusting you to take care of them, was such a different concept of safety, even though as an engineer, all I had done was look at safety. So, I figured out every single way that this device could fail. And then as the nurse using the device, I thought, wow. So, um, I'll go back to this concept about defining a nurse engineer. So again, one of the roles is a bridge builder, right? I can sit in on conversations with someone with a nursing background and an engineering background, and I can hear them saying the same but different things about the same topic or the same questions. So just raising those questions and helping to be that link between the things that we've experienced. The second part of it that a lot of nurses tell me is that all nurses are engineers. And to a large degree, that is absolutely true, right? The thinking processes are very similar. But there is this level of emotional work that goes into nursing that is really, I think, unparalleled in engineering. I know there are engineers, I've talked to a variety of people that have done very high pressure engineering. So whether you're running, say, a nuclear reactor or you are a large engine, engineer where the stakes are very high, somehow, there isn't this intimate connection that I had ever experienced like I did with nursing. So I will say that the next role, that brings you to is how do you bring in engineering concepts to healthcare while
Mm,
still respecting that emotional space and that emotional work? And I know a number of nurses that are going and getting engineering skill sets and utilizing sort of some of those processes to adjunct what they're doing in nursing, and others that are going into design, etc. There's also a number of publications. I'm not sure if the folks on this call are familiar with them, but there was a series of publications by Dan Orther and Mary Ellen Glasgow that talked about a V-shaped profession. So when you actually raise people from the very beginning in nursing and engineering, and there's definitely a program at Duquesne University where folks get the degree at the same time. So they've never actually seen the world from the two separate lenses, like it's one lens together. And the thought around a nurse engineer in that field is that they are tackling big societal issues. So clean water or healthy environments or the types of things where you're engineering a large scale version of health. So that's a very long answer, but I think that the applications of it are as varied as both nursing is and engineering.
So I like the concept of a bridge builder, and it reminds me of how I've often thought about being an informatician in the sense that they're two distinct disciplines that have been trained very specifically in certain areas, but need to effectively talk to one another to reach a common goal. And just the example I always think of is the word code, right? So the word code means something very different from a nursing perspective than it
Yeah,
does for a software engineer. And
yes.
the first time I heard code in a design meeting, I was so confused because I didn't know why are we talking about an emergency situation? And then come to find out it had nothing related to it. And so I think that's a great example of referring to it as a bridge builder, but also you reflecting on the syringe. I can tell you I've never thought about the syringe in that way, right? So that shows my knowledge deficit in terms of the components around what makes that syringe function and probably the amount of pressure we should or shouldn't be applying when flushing a line. Um, which all the more reason why having that knowledge is important. Very interesting. So this segues into the next question, which is, can you share a bit about where innovation fits into the role of a nurse engineer? So you've talked to us about your background, how you came to approach nursing with that engineering background, and then you also mentioned you couldn't find a role that allowed you to be a clinical nurse while also project. So I'm curious as to where you see the opportunity for this role in nursing that maybe we don't have yet.
Yeah, those are all very good questions. I want to start with this idea of innovation first, and I
Sure.
really loved what you had on the website that talked about that innovation occurs through people.
Mm,
Um, so I want to reflect for a minute on innovation. So when I started my career in engineering 20 years ago, innovation was like the buzz. It was the med device required innovation. We had big companies come in and train everyone. We invested in software. There was a whole structure around innovation processes, innovation funding. And that was 20 years ago. And so when I got into nursing and that term was a buzz again, you take a step back. I also spent some time, maybe a little less than 20 years ago, as an innovation program manager for a startup company. So again, in this field of innovation and how do you use that word? What does it mean? And when I came into the nursing field as well, it just continues to go deeper and deeper about what is innovation. There's lots of different definitions to it. You can try to explain it to someone, but I will tell you, in my experience, it is something that you don't understand until you just actually have done it. And it reflects on a whole spectrum. So I want to talk about this for a second because I think it's important. Um, and again, kind of that language and the silos. So when we design medical devices, we actually co-designed with the quality department. We had someone that was called design assurance, and that took us from everything in the device being focused towards quality outcomes, performance, but then also to manufacturing. There's a whole element of quality, right? Like, can you make it the same way every time? Will it work the same way every time? And then monitoring the quality afterwards is how are people using it? So you have this whole built-in idea of change and improvement and things getting better over time, right? When you actually put something out into the world for the first time, it's not going to be at its optimum, right? There's room for improvement. Everybody learns, everybody gets better. And so we talk about innovation as being new or different or having a good outcome, but that's also part of quality, right? And so it's really trying to understand where you're improving a system that exists and where the context is still good, versus when the context of use or the situation of use has changed so much, or the possibilities have changed so much that you can no longer function there anymore. And so I say that because it's like, what is this concept of innovation? Like, we're going from improvement to newness to doing things differently, when in essence, I don't know about you, but I'm doing something differently every single day. But I don't know if I would call that innovation. And so to come back to nursing, and the nurse engineer in healthcare, again, bringing these worlds together in some regards is innovative. But at the same time, you talked about different and new. The nurse informaticist role has been around for a very long time, right? Publications. Maria Hendrickson actually sent me her publication, and I forget the exact date, but it was a well-established publication talking about the nurse informaticist and how that is, a role for engineering in nursing. So again, what is innovation? What is new? I think that I bring you this full perspective to say that a nurse engineer having exposure or the ability to cross the two worlds can help understand what the context is, to help analyze what is, just simple quality control. What is an area for quality improvement where you can use the same processes but get better at them? And then indeed, like, what is innovation, right? What is actually doing it really new and different look like? And then how do we bring together the resources between, the outside of healthcare that needs to build and manufacture and support and bring these things to life into the clinical setting that needs to use them to make patient outcomes and their own work outcomes better. So it's a long answer, but it's a complicated topic about, like, what are you considering innovation, and what are we really looking to happen? And so what I've come across after being in nursing for quite some time is, in my own personal view, I look at innovation as being hope plus action. And I think that it fits in nursing and engineering very well when you think about the two skill sets coming together.
Hope plus action. Okay. And then what would the ideal, so I think your statement of not being able to find the role that you were looking for, what would that look like? And I'm going off script a little bit, but what would that look like? Um, what would your ideal sort of role look like for someone in this capacity that we could work towards, do you think, in the profession?
So I would really love to see nurse engineers be available to every single unit, right? 50% right hands-on patient care, 50% in the improvement role, This is a role where some of other areas of the hospital have gone before. So you talk about like MD PhDs, where it's clinical practice and research or building at the same time and bringing those pieces together. Although unlike the science aspect, the engineering aspect is it's translating science into something useful. So testing, building, as an engineer. My job is often to come in and look at what skill sets are needed, right? Like what expertise is needed? What are the problems that we're trying to solve? And how do I recruit a team of people to enact that, to tackle that, right? I can know a little bit about computer coding, but I can hire somebody that knows a lot about computer coding if I can understand how to bring those pieces together and how to craft the project. And so I really feel like having that resource on the floor, working directly with the clinicians, seeing it with their own eyes, and building that bridge to translation could help give access to where maybe these solutions are already being solved. Maybe it's not a new solution. Maybe it's a solution that exists that needs to be found and implemented. How do we make sure that the teams can function together? Those are all pieces of making sure that we're able to solve what we need to do, the work we need to do in the most efficient and safest way possible. So an army of nurse engineers. There are clinical engineers in the hospital, which has
Yes.
also been a challenge. And in Europe, I have found a number of clinical engineering roles that are actually more clinical than, say, just maintaining equipment or testing equipment. And there also have been roles in the United States, say, LVAD engineers. I actually interviewed a long time ago when LVADs first came out to be an engineer that just sat with patients. Like they needed patients to have like 24-hour monitoring.
Yeah.
The technology has come a long way since then, so I'm happy to say that is no longer the case. But I know there are engineers that are working on teams within those hospitals to find products, look for products. But from the nursing perspective, there's just a lot of opportunity to scale that.
Sure. So we did get a question, so I'm going to read it to you. And could the difficulty in landing a role in nursing be due to the engineering background before going into nursing rather than vice versa? So I'd be curious what your thoughts are. I have some thoughts on this, and I'm curious what you think.
It's hard to say. I did almost 3 years bedside, and I had a role in a health system where I went per diem on my nursing role. But there was actually a lot of friction between staff nursing going into like the other side of the house, and so the resistance was more, I think, at least in that experience, seeing nursing in those roles. And also, using that same comment, the concept of return on investment and things that were used to really push engineering projects in an industry setting are actually quite different in the hospital setting. Value analysis committees are often very disparate in terms of how they're enacted within the health system. Reimbursement codes for nursing, we all know that that's a topic that is difficult. And then also this idea of unit council. So when I was on the floor, I participated in all those things that were available. And this balance between needing to get the work done in the moment versus the improvement. And then lastly, what I've noticed in health systems is this embedded role of quality improvement. So there's a lot of funding and there's a lot of history on using the quality improvement lens to do this work. So in one of the roles I had as a nurse, a bedside nurse, I actually brought quality with me. We were having a slight difference in views upon how to solve one of the problems on the floor. And the quality group had decided to assign that task to nursing. at night they could go and add this to the role. And many of the nurses on the floor just were very dubious as to how they were going to fit that into the protocol, how it was going to get done, and from previous experience knew that all of the other things that needed to get done would take priority over that. So in talking to the quality specialist, I said, come and shadow me, which was kind of a big ask since I had been on the floor for like maybe 6 months. But I'm like, I'm just going to point out a few things that I would have never seen as an engineer until I had done this job.
Sure.
And that person shadowed me for maybe 15 minutes. They were like, okay, okay, you get back to work because this isn't working, and we'll talk. And we put in a number of interventions. We talked about a number of things after that, and that person was then an ally. So I'm going off answering the question a little
Yeah.
bit, but just bringing in some of the
Yeah.
pieces that I've noticed that at least I have witnessed as this barrier to implementing a role within the health system that does this. So clinical engineering exists, quality improvement exists. In many facilities, not all, nurses are not seen, bedside nurses particularly are not seen as the person to play this dual role, at least currently. I'm hoping to change that.
Well, and that was sort of my thought was that you're trailblazing to create this place for this role and open people's minds to what that could be. And so because you're likely the first or one of the first to sort of advocate for something like this in that particular combination of uh, responsibilities, I think that that's disruptive in its own, and disruptive not in a negative connotation, but in the sense of what that means from an innovation perspective of there's going to be a new process, and that in healthcare traditionally leads to some initial pushback. And that's one of the biggest challenges in creating change in healthcare is that there are these sort of established, well, this is how we do it. And so how is it going to fit into how we've done it? And moving outside of that, I find personally, it takes time just to get folks to see the vision before even figuring out how something like that could work. So I commend you for your tackling this particular one. I think something that I feel aligned to that is, the role of the informatics nurse. It has been around for several decades, but it is still tough in some environments. There, I will come across nurses that are one for the entire hospital, and that is a very challenging place to be. But if we're all working on an electronic health record system, it would seem that we would want to have more folks that have that expertise to address it. Anyway, so it's I can't wait to see what you do with bringing this role into fruition for others and opening that door. So this leads me into the next question, which is, what advice might you give someone who's interested in innovation but is uncertain of what to do first?
Well, I think the most important thing that I've learned, I mean, I started out my career very ambitious, very wanting to move quickly. One of the first things that someone reminded me early in my career was that I was a tugboat pushing a cruise ship. And so I think the first thing that I recommend to anybody is kind of twofold. One, never underestimate trust and relationships. And that if you want to innovate, that those will become the most important thing in your life. Uh, Radical ideas, change, those types of things. If you're a passionate innovator, tend to come very naturally for you as a person. But change for many of the rest of the folks in the ecosystem is not aligned with current incentives or current training. And so, that trust and the relationships are absolutely critical. So, look across the ecosystem, learn, try to see things from other people's perspective. And that's why I think nursing is such the ideal profession to be gaining momentum in the healthcare innovation space, because these are skill sets that are just fundamental to nursing, right? Meeting people where they're at, empathetic
Mm.
listening, being able to look at the context of a situation and understand perhaps why something is happening on a multi-layered level, versus perhaps maybe mechanistically why it would make sense that something was happening. And I'll just give an anecdote because this always killed me. When you're an engineer and you're writing out protocols and you're, writing test methods that are supposed to be reproducible, and you're doing IQ, OQ, PQ on equipment, and you're looking for reproducibility and performance. As a nurse, I worked. My first job was in a room with a double room. There was a curtain in the middle,
Okay.
right? And so I mean, you heard everything, whether you liked it or not. And lots of times you get the patient on the other side of the curtain, from the patient that you had the day before. And in that room, you could hear people responding to conversations from all different people. Um, and I will tell you, it was shocking to see how differently people show up for different people,
Mm.
and how what they in their mind perceive as the situation changes based upon context, based upon the relationship of the people in the room. And I'll add to that, just out of interest, because I've been really digging deep into this. That idea that human behavior is simply a result of the context of the environment. And so always remembering this cause and effect. We talk about training all the time, right? Like, well, you're trained to do
Mm.
this, or you know how to
Mm.
do this, but actually the way that you're going to behave is going to be very dependent upon the environment in which you are acting that out. Evidence-based practice, just that triple
Yeah.
Venn diagram is it exactly. Um, so that is the first thing I would say to a person is don't underestimate what needs to go into the trust and relationship building when you want to get into innovation. And the second part of that is, think about what you want. So innovation is twisty turny. The failure rate is much higher than the success rate, as it should be, right? If you're, I think, pushing the limits and really finding out what's innovative, you're going to hit a dead end more often than you'll hit a success. And so really staying true to you, what skill sets you bring to the equation, where you need to partner, and realizing that success in innovation is I think, you said it well, is not the solution itself. In your quote on the website, it's really about this process and these people, and that you individually can be successful in innovation even when your project maybe not successful.
Yeah. I'm just reflecting on what you're saying about relationships, and I often think about the assessment process that nurses are um, introduced to and very early in their educational perspective. And, walking into that patient's room, you could get report on the patient and have a picture painted for you. But you're not really going to know until you walk into the room and set eyes on the patient and get that um, holistic overview of what's happening at this moment in time to then gauge, okay, yes, these are the things I need to do for the patient today, but I need to figure out how I'm going to do it for this person. Because that's going to make or break the relationship we're going to have. And so, what you're saying is understanding, at least my interpretation, is understanding where you're at with the group of people that you're working with. It may not be patients, but these are people that you're going to be interacting with. You're going to need to be supportive, using the items, understanding their needs, even if you are aiming to give them what they need to see it first too, or they need to be able to see it and recognize it. And um, that's something that I think is not highlighted enough in change making. Is that you could make the next best, controller or whatever it is. But if people don't know why they're supposed to be using it, it's not necessarily going to get utilized. And so that has to happen through interactions. So what a great way to think about innovation, because that's such a natural skill that nurses have, is the ability to interact with other people. It's core, it's core to what we do, right? It's about um, the science of caring, that ability to see where people are and what they might need. So interesting. Okay, so with that, and I'm going to ask you and see how we're doing on time. So this might be the last question. I'll leave others to see if they have questions or if there's anything else you want to add. But so with all of what we've talked about, what would your vision be for the future of nursing and healthcare from any point of view? Like, what would you like to see nursing evolve into with your lens and your interests?
Yeah, so I'm wrapping quite a few of the threads that we've talked about. This V-shaped profession concept, as nursing is, evolving to include, health of the planet. They're all flavors of the same thing. Nightingale with the environment. Again, our behavior is a result of our environment. Um, you know, Taking someone over to sit by the window is, a nursing intervention, because we understand all of those different interactions and complexities. So I think what I've been impressed upon is I started my career in this med device space. And what I quickly came to learn is that, and everyone says, oh, yeah, this is a device or it's solution. And what I quickly came to learn was that devices are embodiments of processes. And if the device itself doesn't embody the process, then it becomes the process. So anyone that has placed a Foley catheter has experienced that in too many frustrating of ways, right? You have what you're working with, and that's going to be your process, whether you like it or not. And with that siloed impact, that thought of it, like just thinking about all of the medical innovation that I've worked on, talking that they're patient care devices, but really it was this interaction piece, right? It was highlighting the different aspects that needed to be there and how it needed to be there, and looking at it not from this like linear, this technical innovation, but from these processes and these changes. And with that, I'll say that the reality is that nursing is not confined to hospitals. I mean, when I came into it, I wanted to work at the bedside, because that's where the action was, right? And those were the products that I had worked on. And I will sadly say that I actually used some of the products in the OR that I had worked on. And all I could do is shake my head like, wow. It's a shame on me for not understanding better what this could have been if I would have understood that that innovation can be all of these things. And so I'll go back to the thought around nursing as being this amazing lens. I mean, I look at nursing, yeah, nursing can rock out tasks, no problem. I have never done anything so physically demanding or emotionally exhausting as I did when I was nursing. And I used to do 14 plus hour days as an engineer, but it was just not even comparable. And so that emotional work, that's required. So putting this back all together is innovation in healthcare needs to be outside of the hospital, right? I just listened to a podcast out of the IHI where they were highlighting Northwell in New York. I don't know if you're familiar. I'd not heard about this system before, but they're talking about how do you loop in education, how do you talk, loop in community gatherings, how do you do all of these things, and so really bringing, health back to every day, every part of our life, right? The way that you buy your clothes or eat your food or educate your kids, instead of or in addition to many of these other medical interventions that, yes, can extend life, but you'd be a lot better off to have your knee replaced if you are overall healthy and in a good place because the other aspects of your life have been benefits of innovation as well. Oh, I think you're on mute.
Innovating how we think about health. I think about that a lot myself. And what a great point about nursing not just being in the hospital. When I was being trained, we were largely being trained to work in a hospital setting, and the only roles that I was aware of at that time were, well, this was also sort of pre-mainstream internet. It feels like I age myself when I say that. So you knew what was around you or what your family was involved in. So that was the equivalent of working in a hospital, working as a nurse manager, working as a travel nurse. And then to see sort of, here we are 20 years later, and one of the things I'll say to anyone that will listen is nurses should be in all places where healthcare decisions are made, and that creates such a wide variety of opportunity. But it also reflects on where do we see health and how do we, as individuals, reflect on our health. What does that mean? So that I see as a big potential shift culturally to get to a place where we're thinking about it before we need the knee replacement. Like, how do we avoid that for as long as possible? What can we do to prevent that, or whatever it may be? So I'm definitely in alignment with you there on thinking about health as a daily event and not an episodic one.
Makes you wonder often, again, having pulled out that silo, right? I mean, to med device, and then
Yeah.
coming back, and then realizing that, I will tell you, I can remember all the things that I studied around, say at surgical prep. It was one of the products that I was assigned to right out of school. And all the science and all the money and all the things that went into it. And then, you get into the OR and you would see the prep and you'd see all of the money that went into that and whatnot. And then I would reflect on the care that I provided on the floor or the patients that you saw come in the next day. And you would just think like something isn't adding up here, because, we can replace a person's knee, but they can still die of infection. And in today's day and age with the tech that we have, somehow it just doesn't seem like that should be the outcome. And so I like to think to myself that, do we really need to move back to this place of balance? Again, holistic look as a nurse lens to all of the pieces, not just some of the pieces. And how, knowledge about what to eat and, how to keep your home clean and how to, you know, lower anxiety because you do certain things in your environment. Like those are all also keys to, say, having a successful knee replacement. And so it's been fascinating to take the journey from the mechanistic linear to this complex adaptive system, and back again. And I think that's what it still excites me about the nurse engineer, and the idea of a bridge builder, because we have so much information in our world, right? Like, if you really want to get right down to it, technology is not a limiting factor. We can figure it out at this point.
Yeah.
So how do we figure out how to work together, how to live together, how to, take the moments of health and enjoy them, make sure that everybody can have access to something as simple now as penicillin. Those types of things, to me, seem like the bigger opportunities for innovation.
Well, just your comment of technology not being a limiting factor, and the technology's traditionally and historically been ahead of where people are ready to accept it. And you know, at least in the last couple of decades. Before that, there have been some technical barriers, but the barriers to some extent have been um, ourselves, in by way of either regulation or policy or willingness to change, or financial is a huge component, but the technology itself has for the large part been available. I mean, I think about telemedicine, and that um, has been. I remember being at a conference in October 2019, right? So 6 months before the pandemic. And there were groups talking about how they were being creative and innovating on how to use telemedicine because they could not get reimbursed for the service. And 6 months later, we were in a pandemic, and then all of a sudden we were able to bill for it. So the need was big enough, but from a professional standpoint, I think we sometimes hold ourselves back. And not necessarily always in a um, detrimental way. I think there's definitely risks that need to be evaluated and
Yeah.
assessed, but it does take some time to sort of do that reflection.
Well, I think you nailed it. I mean, I think that's the key, right? Is
Yeah.
this time and incentive. Um, our current systems need redesign. You can't reflect, you can't do these things without a lens where you are empowered, you have the time, and you have the incentive to make the improvements. Um, and they say that every system is perfectly designed for the results that it achieves. And if you go through the existing med tech landscape and sort of the way that that whole system is set up, I mean, it is optimized right now. It is achieving at its optimum, really what it's allowed to do. And we could go into that at another time about the 510(k) process and regulatory barriers and those types of things that I've even seen change um, the ability to really understand the customer needs from an engineering standpoint. But again, um, those are the places for innovation, right? And some people are making it work. I mean, I've talked to people that are, putting in nurse replacements, so having relief for people on the floor so that
Yeah.
they can go and train and practice and contribute to improvement. So when there's a will, there's a way.
Hmm. Very good. Well, so we have just a couple minutes left. For anyone have any questions that they want to ask Kelly? Or Kelly, if you have any questions for us? Let's see if there's any other questions. I'm not seeing any come through. Any sort of final, sort of parting thoughts for us that you can think of, Kelly, or anything that's you see on the horizon, or things you were talking at the beginning, you were at a couple of conferences, so you probably saw some interesting um, directions for the future.
Yeah, I think my biggest reflection, and I'm excited. I think the things in the ecosystem are finally coming to a point where through collective impact, through bringing stakeholders together to realize what they really want, that there could be enough momentum for us to make some significant changes in health and healthcare. But at the same time, I think it's important for us to realize that we are the change. It's incumbent upon every one of us to ask for the right people to be in the room, to make sure that you are, using your lens to figure out what you don't know, and to be okay with that and say, I don't know this, and I'm going to bring in somebody that might, even though it is hard and it is frustrating, and sometimes you feel like it would be easier to just keep doing what you're doing. Um, but that we each of us hold the power to, I think, bend the curve to the health system, and to realizing the power of nursing, just by opening our own minds to what could be, um, if you really evaluate the situation for what it needs.
Thank you. So we have some feedback from Kristen. Thanks for taking the time to talk with us, Kelly. You are inspiring. I enjoyed hearing about your unique experience in healthcare. Me
Thank
too.
you.
Me
Thank you.
too.
You through the website, you can contact me anytime. I know we didn't get into any of the crux, and you might have been a little surprised I didn't talk more about engineering. But the engineering resources are there. If you have questions, reach out to me. If you want connections, reach out to me. The getting those resources on your teams or being connected with someone that can help you see that side of things is more than doable. And I'm always happy to chat or answer questions. I'm just really excited about the work that you're doing, and hope that the future holds lots of interaction, lots of bringing people together to look at these problems and these needs from that holistic lens.
Great. Well, thank you very much. I really appreciate you joining us and everyone else for joining, especially so close to the Thanksgiving holiday. I'm sure this is a busy week for everyone. Another feedback, this session has been insightful. The background dynamics and experiences make listening to you interesting. So thank you. I think
Yeah,
you've inspired everyone here this evening, which is always good. And we'll stay in touch.
sounds
Um,
great.
and so please, if you would like, please reach out to Kelly. She's also on LinkedIn as well. You can find her there and follow her journey. I think that's how we met, is by way of LinkedIn.
Yeah.
And well, have a good evening, everybody, and have a
Thank you.
happy
Thank you for
holiday
the
season.
opportunity.
Yes, thank you. Take care, everybody. Good night.
Good night.